Thank you for joining us on another edition of To Your Health. I want to thank you for our audience for coming in today and for those of you joining us at home. Okay, for those of us that have kids, grandchildren, nieces, nephews, pay attention because the numbers are real. Let me read you these statistics. Approximately 30% of high schoolers and almost 10% of middle schoolers are using e-cigarettes. That is up almost 1 million users since 2017. All right? Now, I will tell you there's some good news. The good news is that the CDC has recently said that the smoking among the same age group has gone down, saying that only 10% of high schoolers and middle schoolers are smoking. That is down from 2016, okay? So that's the good news if you want to look at it. November is Lung Cancer Awareness Month, okay? And tomorrow is the Great American Smokeout, which is an annual event that encourages the public or those that smoke to quit smoking, at least for the day, and hopefully beyond. Joining us today to clear the air on smoking and vaping and e-cigarettes, juuling, whatever word is used to describe the puffing, is Dr. Ari Zaiman. He is a pulmonologist with GBMC Health Partners. Dr. Zaiman, thank you for joining us today. We have a lot of information to get to, so why don't we get rolling, all right? Okay, so let's start with smoking, okay? What types of diseases can be related to smoking nicotine?
Almost everyone, not almost everyone. The obvious ones are lung cancer, COPD or chronic obstructive pulmonary disease. Other ones that you may not think of, stroke, there's a 2 to 4 time increased risk of stroke, cardiovascular disease, heart attack, 32% of cardiovascular mortality is attributed to smoking, rheumatological diseases, rheumatoid arthritis, diabetes. It increases the risks of other types of cancer and makes them more resistant to treatment. Peripheral vascular disease, just to name a few.
Okay. You know, before our program started, we were talking about the importance of those that are smokers talking to their physicians about their habit. So why is it important for physicians to ask patients about their smoking history?
Most people don't really like to tell you about it. It's become less socially acceptable. They tend to minimize how much they've smoked over the past several years, and if it's in the distant past, they don't think it is as relevant.
Okay. We talk about cigarettes. We talked about e-cigarettes, but there's also smoking a pipe, smoking a cigar. Do those have any different effects on your health than others? Is smoking a cigar a lot worse than smoking a cigarette? Is smoking a pipe a lot worse than smoking a cigar?
No, they all have the same effect. It depends on how much you inhale. It's the smoke going into the lungs. So one cigar may equal a pack of cigarettes in the amount of tobacco you use. If you don't inhale, the cancers are usually of the oropharynx and larynx. But the nicotine that you absorb into your body is the same. And if you inhale, then the risks are the same.
Joining us today is Dr. Ari Zaiman. He is a pulmonologist with our GBMC Health Partners. Dr. Zaiman, thank you again for joining us. Before we get to our questions from our audience and those that are watching us at home, how do you suggest a physician bring up how to quit smoking with their patients, considering that tomorrow is the Great American Smokeout?
How to bring up quitting smoking? I think it is just bottom line, you ask them whether they're smoking, and it is the single greatest intervention that can happen in both the length of their days and the quality of their days.
All right, we do have a question from our audience. Laura.
Okay, so this question is from Dee. We've been talking a lot about e-cigarettes and vaping. Is there a difference between the two?
No. E-cigarettes and vaping all use a similar type of mechanism. Instead of combustion or burning the tobacco, they use a liquid that's heated with an atomizer to make a vapor, and then you inhale the vapor. And it's just e-cigarettes, vaping, juuling, it's all the same mechanism.
So you spent years treating patients who have been heavy smokers. So from that perspective, what are your concerns as a medical professional about e-cigarettes?
One, the lack of knowledge, the perceived safety, and the popularity among the youth in terms of starting it. This is a major corporations and it's $1 billion industry. So generating a nicotine addiction makes it more likely that people will eventually smoke.
Okay. On the table here, we do have an example of an e-cigarette. So can you explain to us and our audience and those watching us at home, how do e-cigarettes work per se? And I'll let you use this if it helps.
So e-cigarettes are composed of 3 parts. They have here, this is the capsule, which has inside it is a nicotine solution. And you can get various nicotine solutions, various flavors. There is a battery, and then there is a charge to heat up the liquid to make a vapor, and then you inhale it.
And if you can just hold up this one, it does look very similar to a flash drive that you put some information, use on your computer, right? So a lot of the kids, they kind of hide it almost in plain sight, because when you take a quick look, when I first saw it, I'm like, oh, that's a pretty interesting memory stick. I didn't think of it that, but then when I looked at it close, I'm like, oh, that's not a memory stick. That's quite the opposite. So it kind of looks like this, and I like the way you broke down on how this actually works. We appreciate that. So let's go do a little bit of history on the e-cigarettes. Apparently, e-cigarettes were introduced and produced for smokers to get a nicotine hit without the use of tobacco. So are e-cigarettes a safe alternative to cigarettes? Are they stop smoking tools? If yes, or on the latter, is there any credible science that shows that e-cigarettes do help smokers quit?
That's a lot of questions.
Well, good. Hope we have a lot of answers.
So let me try to break it down. That when you compare e-cigarettes to cigarettes, cigarettes have over 7,000 different chemicals in them. Over 50 to 70 have been labeled carcinogens. E-cigarettes have been shown to have various chemicals as well that are and toxic, mostly a lot of them related to flavoring. So just the comparison, could it be safer or less toxic than regular cigarettes? But that's a possibility. Is it the question of, is it safe? That's another question. So there is moderate evidence that it has less toxins or certain toxins than cigarettes, but the safety of it is less clear.
Joining us today is Dr. Ari Zaiman, pulmonologist with GBMC Health Partners. I encourage those watching us at home or at work during their lunch break, which is a good idea, and our audience members here, that if you have any questions, please send them in, or if you're in studio, please provide them to Laura, and we'll do our best to get them on our segment. Actually, we do have a question. Laura?
Okay, so we've been talking about the differences between e-cigarettes and regular cigarettes. Is there a difference with secondhand smoke since there are different toxins in them?
So one of the things that we have to also, as a caveat to, is that the research on e-cigarettes is in its infancy. In terms of the secondary effects of e-cigarettes, they've shown that it does increase the level of nicotine that is in the room, in a small room. The health effects other than that, and particulate matters, but the full health effects and the risks aren't known yet.
In the introduction, we talked about the popularity of e-cigarettes, vaping, juuling, whichever term you want to use, among among teens here in the U.S. Why do you think it's become, I mean, as a medical professional, your opinion, why do you think it's become so popular among teens to use e-cigarettes?
Especially, I mean, Juuling, which has, and that company has 70% of the market. They have various flavors, and that's always been shown to be an appeal to the youth. It's easy to hide, flash drive. You can do it. People do it in school. They don't even know about it. It doesn't smell, and they think it's cool.
We have a question that came in prior to our program from Conway, and they asked, so many kids are juuling and this nicotine is addictive. Are there any studies that show the long-term effects of this on kids, on children, or young adults?
Of nicotine, yeah, I mean, they have a lot of long-term studies of what nicotine, and the Surgeon General has come out saying nicotine is the active ingredient in tobacco, in cigarettes, that cause it to be addictive. It is as addictive as heroin. The developing brain and in youth gets changed by it. If you look at smokers, the majority of smokers who continue started before 18, the vast majority.
Another question that came in is, do you think that e-cigarettes are more dangerous than regular cigarettes on a young person's lungs and brain? And if yes, why? Or if not, why?
I'm going to take the fifth. I don't, there's not as much, the variability, to do the studies, you need time, and there's variability in terms of the e-cigarettes, both across the board in terms of how hot they get, what they burn, what solution it is. So to make a blanket comparison, I think the risk of an addiction to nicotine is significant, and they've shown that it affects the developing brain very differently than a mature brain, and that people will do a lot of things to fulfill their addiction.
Joining us today is Dr. Ari Zaiman. He is a pulmonologist with GBMC Health Partners. I encourage you, those watching us at home or at work, to please send in your question, and our audience members, please provide Laura or Tamika with your questions if you can. Yes, Laura.
So we have a question from Howard.
Doctor, did the FDA conduct equivalent of clinical trials before the e-cigarettes were commercially introduced in any fashion whatsoever?
I'm not sure of the exact answer, but I don't think that I don't think so, but again, I don't know.
So in order to get a drug onto the market, the FDA goes through a whole series of clinical trials, so that didn't happen to apply to e-cigarettes, I guess?
So in order to get a clinical drug to market, the FDA has to approve it. I don't know whether there were any studies beforehand about, or how the FDA evaluated it before they got to market.
So the product that got to the market unregulated, so to speak, apparently.
Again, I don't know the details of the FDA, how the FDA did it beforehand, so I can't really I can't answer it.
It seems to me they're trying to regulate after the fact, is the impression I'm getting from public information. Seriously.
No. They're trying to regulate it. Does it? So I hesitate to. I'm happy to answer it offline, just because my knowledge of the facts about this, and I don't want to mislead anybody, and I don't. But I believe that not every cigarette and the change in cigarettes goes through FDA approval. So I'm not sure about what preclinical studies that were done beforehand.
Thank you for your question, Howard. Appreciate that. Real quick, we talked about, remember I said to the audience, if you have a grandson or granddaughter, a nephew, niece, if you have a child, like I have a middle schooler and a high schooler now. So let me ask you this question. What are some of the signs that parents can see in their kids if they are using, or if they're vaping or using e-cigarettes? Is there any outward sign that you can pick up on as a parent that says, hey, wait a minute, something's going on here?
It's really difficult. If you think about it, just picking up that kids were smoking when we were young, how to hide it. Smoking had a lot of smell associated with it. Withdrawal symptoms you can see, but you may not know if they're using it, and that's one of the difficult things.
Okay. Speaking of kids, and we talked about this before we went live on our program, there's been stories in the media about kids vaping synthetic substances like flakka and other various forms of quote-unquote legal weed, K2, for example, and spice. Can you explain, if you can, how vaping these items can be more concentrated and dangerous? And if so, is there any medical information that shows that health issues that kids and young adults face if they continue to vape these items?
So most of this research, especially, there's a lack of research on the matter because the drugs are illegal in most places. So to actually do a study to see long-term effects or what these effects are. The drugs can be very toxic. I mean, overdosing on K2. My other hat at the hospital is I also work in the critical care unit, so see overdoses, drug overdoses, marijuana K2. It's not pretty, but in terms of long-term effects, can't answer.
Joining us today is Dr. Ari Zaiman. He is a pulmonologist at GBMC Health Partners. And before we get to the question, I have a question for you. What inspired you to become a pulmonologist? And what is a pulmonologist? How about that? We'll start with that.
So pulmonary is a study of lungs, so and all lung diseases. So it often is associated with critical care, and I really enjoyed the physiology and acuity.
Good. All right.
So
awesome. We have a question from our audience. Laura?
Okay, so we know that there are age regulations on regular cigarettes. There hasn't been much research on e-cigarettes, but do they have age restrictions on those?
So the FDA is currently looking at it, the youth smoking has recently, and the Surgeon General has called it, because of the increase, caused it an epidemic, and are trying to curb it. So they came out with recent regulations or suggestions, in particular about how to keep youth away from smoking. One of it was to ban flavors, and Juul, which is the lion's share of the vaping market, has just announced last night that they're taking away flavored pods from a commercial, and you can only get them online. So they're trying, or there is some effort to curtail this e-cigarettes among youth.
We don't have much time left in our program today. Again, Dr. Ari Zaiman, pulmonologist with GBMC Health Partners, joining us today. If you have any questions, audience members, please hand them in to Laura. For those of you watching us at home or at work, please send in your questions. We'll be more than glad to get them on our segment. We talked about tomorrow being the Great American Smokeout, and it's a day that encourages those that smoke to quit for the day and hopefully beyond that. So let's put on the other hat. We talked about vaping and e-cigarettes. Let's talk about smoking and smoking cessation in general. What are some of the healthier ways to quit smoking? What would you tell our members here and those watching us the healthier ways to quit smoking?
Whatever works for you. Smoking is an incredible addiction. I've had people who said, I've given up drugs, I've given up alcohol, don't take my cigarettes. There are the most effective way is both a desire and then smoke cessation. There are smoke cessation aids, whether it's nicotine replacement, there's gum, there's sprays, there's patches. There's also two other medications, Zyban or bupropion and Chantix, that can all be used to help stop smoking.
Well, that was my next question about some FDA medications that have been approved to help those quit smoking that wanted. You named, can you just name them again?
Zyban and bupropion is one, Chantix is the other.
Let me ask you this question. What do you think needs to happen? What is the next step to closing the gap of the current challenges that are opposed to smoking cessation in the U.S. You know, there's been for many years that the Great American Smokeout has been one way. But what are some of the other ways to kind of close that gap? The numbers have gone down, which is great. I mean, we talked about in the intro that the numbers, especially among teens, has gone down in smoking. But what are some of the other things that we can do to help decrease those numbers and get it to a low number as possible?
I mean, I think that one of the major things that has also helped is the public policy of no smoking areas. So they used to be very common. You used to come to work and smoke, and you can't do that. And I think just increasing knowledge about the ill effects of cigarettes is helpful. I mean, knowledge is one thing. When you're fighting an addiction, you have to get family and everybody to tell you, and keep telling you.
We got about 5 more minutes left in our show. Dr. Ari Zaiman.
Zaiman.
I keep messing it up.
It's
I'm
okay.
so sorry.
Totally fine.
Well, it happens when you're alive. You can't take it back. Before just a couple of quick more questions. So, this question came from Carol before our show. She asked, "What is popcorn lung?" I'm thinking I went to the movies and something got stuck in there, maybe it. But no, go ahead.
It gathered its name because of popcorn flavor, and there was a series of cases. Popcorn lung is a lung disease of small vessels, of small airways, in the lung. And it's also known as obliterative bronchiolitis. It has but basically, it's a destruction of the small airways in the lung that results in shortness of breath.
We got a couple more minutes left, so let me get these quick questions out that came in from our audience members before the show. Does vaping without nicotine affect your lungs?
So again, lack of information. Vaping with flavors, because otherwise you're just inhaling hot water. The vapor it's sort of a humidifier. So vaping with flavors, the flavoring and what they use to make the flavoring is what some of the substances which is what causes popcorn lung, diacetyl. And so, is there a potential that it's harmful? Yes.
And this other question came in before the show as well. Should e-cigarette users be concerned, and should they stop vaping? What is your thought on that?
So, one is we're isolating a population that is previous smokers. So, would it be better to stop smoking and stop vaping? Absolutely.
Joining us today is Dr. Ari Zaiman with GBMC Health Partners, you're a pulmonologist, and we talked about why you enjoy and the critical care aspect of your job, which is great. I want to thank you again for joining us on this show and providing our audience members with some good information. And for those of you that watch, like I say every month, I hope if anything you guys learned something new to your health, and that you take away some good information about our program. And please, if you have family members that have kids, again, if your grandchildren, please open up the dialogue. Talk to them about what you learned here today about e-cigarette use, smoking. I think it can go a long way. And again, thank you, Dr. Zaiman, for joining us. Before we exit our show, I want to send out a special birthday wish to Mindy Shiflett. Mindy is, it's okay. Yeah, I can applaud. That's fine. Mindy turned 29 yesterday. No, but a lot of what you all see at home and what you all see here in the audience is possible because of Mindy's good work, and it's a joy and a pleasure to work with her. Happy belated birthday, Mindy. I know it was yesterday, so I hope you enjoyed your day and got spoiled rotten. Okay, tomorrow is the Great American Smokeout, so if any of our audience members smoke or know someone who smoked, please tell them to quit, at least for the day. That would be very helpful. Next month, we are going to talk about pelvic floor disorders. We are going to be joined by a GBMC urogynecologist.
Gynecologist.
Yeah, thank you. There you go. I'm going to leave it to the professional to say it. That would be great. But until then, cheers and to your health. And happy birthday, Mindy, even though it's belated.